Experiencing or witnessing a traumatic event doesn't just end when that incident is physically over. Sometimes what comes after is just as traumatic and can lead to severe mental health problems if no help is sought. This is what is known as post-traumatic stress disorder, and many of us go through it without even knowing it. Today on Health Matters, we're taking an in-depth look at PTSD. Post-traumatic stress disorder. Many of us think this is something that affects mostly soldiers who have returned from war. Well, it's what we've seen in the movies. But PTSD can affect any one of us.
PTSD, or post-traumatic stress disorder, in essence, is just a mental condition that gets caused or that gets triggered by a traumatic event. And when we speak about trauma, it can literally be anything. It can be bullying, it can be being mistreated really badly in the workplace, all the way to really severe events like war or natural disasters or crime, or being involved in a really bad accident.
When a person suffers from PTSD, they experience certain triggers that can bring back memories of the traumatic event, and this often comes with intense emotional and physical reactions.
One of the symptoms is what's called intrusion symptoms, and these are involuntary, they are distressing, and they can take the form of memories, they can take the form of nightmares or dreams. There's what's called avoidance symptoms, and that is where the person tries to do certain things to avoid both internal and external reminders of the traumatic event. In some instances, they can even take the form of what's called a flashback. Another symptom or group of symptoms could be a change in how the person thinks, a change in how a person feels. The person there could have irritability, they could be angry, and they could also start to develop things like an inability to experience positive emotions. And these symptoms then lead to what's called hypervigilance or hyperarousal. In essence, this person is always on edge, always looking out for something else to happen to them. And these symptoms are distressing. They're not caused by substances, they're not caused by diseases, and they cause a disruption in the person's life.
While many adults might avoid confronting the trauma after the trauma, most are aware of PTSD and would be able to identify the signs. But for children, this might be a little more difficult.
You could have a child that used to like running and jumping and playing, and you notice that they don't like to do that anymore. They can also have anger outbursts as well. Or in some instances, they can actually become even more clingier to their parents. And the thing that is advised to be done for those little ones and teenagers as well is to constantly assure them that they're in a place of safety, that the people that they are talking to are safe. Then once that happens, then you can start helping them in an age-appropriate manner to start to process the trauma.
Depending on the nature of the trauma, long-term intensive therapy might be needed, and it's important to know when to seek further help.
The first port of call is to have a trauma counselor or trauma psychologist interacting and talking with the survivor of the trauma. The best outcome, however, does come from a combination of the psychologist as well as a psychiatrist like myself. So briefly, the psychologist will help with coping skills, and the psychologist will look out for any development of things like depression and anxiety or the usage of substances. And we see those when a person tries to self-medicate.
PTSD is not to be taken lightly. It is misguided to think that a few nightmares or jumping at the sound of a slamming door aren't a big deal and will eventually pass. If you have suffered or witnessed any kind of trauma, pay attention in the weeks and months after for anything out of the ordinary, any changes in how you feel or react to things or people around you. PTSD can creep up on you when you least expect it, but it is not something to be ashamed of. It is a very real, very normal reaction to a traumatic event, and getting the right treatment will ensure it doesn't take over your life.